Hello, I'm John Lewis with ACRO. I'm joined today by Tony Coelho and Sara van Geertruyden of the Partnership to Improve Patient Care. Tony is the chairman of the organization and Sara serves as executive director. Welcome. So one of the issues with PCORI and the whole kind of notion of the government doing and trying to disseminate this type of research is questions about rationing and other kind of hot topics that come up in the discussion. And there's some interest in possibly limiting PCORI funding, but how do you see the agency going forward in terms of its stability and its political support?
If it keeps its focus on what the intent of the Congress was, and that is to be patient-oriented, patient-centered, it has no trouble. If it moves towards being just another ARC or just another NIH, why have them? And so if it moves more and more towards being patient-focused, being successful in doing quality of life for patients and so forth, has no trouble at all.
So what would you like to see next in the area of comparative effectiveness and in PCORI? Where should they go?
I think basically moving more and more towards, as I indicated, more and more towards quality of life. How do you improve the daily routine of those individuals who have disabilities, of anybody in the patient in regards to what is going on in their daily lives? I think that's what a lot of people are interested in. If you did that, you would in effect reduce the cost of healthcare. And that's what I think the Congress was looking for. How do you increase the quality of life? How do you deal with the daily health care problems of individuals and let patients decide what is their needs, what are their concerns, as opposed to the researchers deciding what it is that they think patients need. Let the patients decide what it is that is bothering them and what are their concerns.
Is there anything else you'd like to add?
Well, I think one step in the right direction has been the creation of the expert advisory panels at PCORI, and that I think hopefully will lead to a process by which they can choose research questions that come directly from patients and their clinicians, as opposed to coming from, being researcher initiated.
I think the most important thing, I think Sara and I would agree that researchers are needed. We're not saying that we as patients want to do the research.
Sure.
We desperately need the research. We just want to make sure that patients have a role in deciding where the research should be. And that's, I think, the distinction here.
So if we'd like more information about PIPC, where would we find that?
You can follow us on Twitter at PIPC Patients or go to our website, pipcpatients.org.
So for more information about ACRO, please visit us at acrohealth.org or follow us on Twitter at acrohealth. Thank you.